Health, mortality down 67% since 1950, but anxiety, depression, and deaths among young people are rising. Global life expectancy has returned to pre-pandemic levels. 76.3 years for women and 71.5 for men, over 20 years more than in 1950. In 2023, the age-standardized mortality rate fell by 67% compared with 1950. These findings come from the new Global Burden of Disease, GBD 2023, study published in The Lancet and presented at the World Health Summit in Berlin. Alongside the progress, the study highlights an emerging emergency: rising mortality among adolescents and young adults in various regions. The sharpest increase concerns people aged 20-39 in high-income North America, 2011-2023, mainly linked to suicides, drug overdoses, and alcohol. Over the same period, deaths among those 5-19 years rose in Eastern Europe, high-income North America, and the Caribbean. Major gaps persist: up to 83 years of life expectancy in high-income regions versus 62 years in sub-Saharan Africa. Non-communicable diseases, NCDs, now account for almost two-thirds of global mortality and morbidity. Leading causes include ischemic heart disease, stroke, and diabetes. The GBD estimates that nearly half of deaths and disability are preventable by addressing key risk factors, notably high blood glucose and elevated BMI. The study, led by Christopher Murray, IHME, University of Washington, integrates data on 375 diseases and injuries and 88 risk factors for 204 countries or territories and 660 subnational locations, 1990-2023. It is the most comprehensive quantification of health loss available, childhood and adolescence. Deaths in children under 5 declined the most over the entire period. In East Asia, 2011-2023, the rate fell by 68% thanks to better nutrition, vaccines, and stronger health systems. In sub-Saharan Africa, mortality among 5 to 14-year-olds, 1950-2021, is higher than previously estimated. Respiratory infections, tuberculosis, other infectious diseases, accidents. Among young women aged 15 to 29, mortality was 61% higher than earlier estimates, mainly maternal mortality, road traffic injuries, meningitis. Causes of death. After peaking in 2021, COVID-19 fell to 20th place in 2023, while ischemic heart disease and stroke returned to the top, followed by COPD, lower respiratory infections, and neonatal conditions. Since 1990, mortality rates have declined for ischemic heart disease, stroke, diarrheal diseases, tuberculosis, stomach cancer, and measles. They have increased for diabetes, chronic kidney disease, Alzheimer's disease, and HIV/AIDS. Key message. According to Murray, the data are a wake-up call. Rapid population aging and the evolving risk landscape demand targeted, timely responses on youth mental health, NCD prevention, and reducing inequalities.